coming up. We'll be on location at Optimal Performance Rehab in Rockville, Maryland, discussing the latest advances in chiropractic care and physical therapy and how they can effectively treat pain and injuries and help you get back to your active and healthy lifestyle with one of this region's top doctors, Dr. Dillon Balkin. Dr. Balkin received his chiropractic degree from the prestigious Palmer College of Chiropractic and is widely recognized as one of this region's top doctors. Welcome, Dr. Balkin. It's a pleasure having you on our program.
Thank you. Thanks for having me.
It's your first time, in fact, on with us. We have a lot to talk about. We're going to hear from a couple of your patients a bit later. But I wanted to begin, if I may, Doctor, by first asking you to please tell us a little bit about the integrative approach that you utilize here at your practice, because you have expertise in a number of different effective modalities that are helping a number of folks throughout this region. And I wanted to just have you please tell us a little bit more about that approach.
Absolutely. So here at Optimal Performance Rehab, we definitely use an integrative approach. And essentially what we do here is we take three pillars, like I like to say. So we have the chiropractic side of things, we have the physical therapy side of things, which is going to be more of like the exercises and things like that. And then we have the soft tissue. By addressing all three components, putting together the chiropractic, the physical therapy, and the exercise, this is when we've really been able to see the best results and the most long-lasting results with our patients.
Yes, indeed. And you customize your treatment plans, obviously, according to each patient's needs and their situation.
Absolutely. So each patient that comes in, here at Optimal Performance Rehab, we see a variety of patients from the youth level to the professional athletic level to the elderly level. Each patient is treated differently. So what's the best treatment for one person may not be the best for another. So here we have a variety of different treatments that we offer each person based on what are their capabilities and what are their goals, what are their needs to get them back moving as they should.
Yes, indeed. And speaking of those treatments, I wanted to ask you, Doctor, if you could please tell us about what some of those effective treatments are.
Sure. So one of the most common treatments that we use here would be flexion distraction, which is geared towards low back pain. Now, currently, experts are saying that over 80% of Americans will experience low back pain at one point or another. So it's a treatment that I use practically daily. Now, flexion distraction is a form of traction geared towards low back pain. And what this table does is opens up the joints and the discs of our low back. This alone creates pressure, takes pressure off of those nerves, takes pressure off of the disc to promote some healing and some movement in that area. The table will then flex up and down and move in this pattern. What that does is acts as a vacuum, so if they have any type of disc bulge, protrusion, herniations, or they're experiencing radiating symptoms down their leg, what's going to happen, we're going to pull the gel away from the spine, away from the nerves, creating some space there so that they're moving a little bit better, which then allows us to transition into the therapeutic exercise to begin the true healing process.
Very interesting.
Yeah. Some other treatments that we offer here are things like cupping therapy, things like Graston therapy. Speaking on the cupping therapy, it's a tool that we use which is extremely decompressive in nature. What it does is lifts the skin up, allowing any type of inflammation or edema that's begun to develop underneath the muscle tissue, allows that to kind of filter out. We then, while the cup is on the patient, take them through ranges of motion. This increases their range of motion, the pliability of the muscle, and promotes healing. Some other things that we use are things like Graston therapy. This is a stainless steel tool. What this tool does is breaks up scar tissue. If you've been in an auto injury, a sport injury, or you're just experiencing excessive motion, chances are you've developed some scar tissue. What this does is it limits our range of motion and can cause some irritation in the surrounding area. So we go and we scrape the muscle, smoothing out this tissue so the patient is moving better. So another treatment that we commonly offer here is intersegmental traction. This is a machine that is geared towards increasing some of your spinal mobility. Now, almost all of us are going to be flexion dominant. We're at our computers, we're on our phones, we're kind of hunched over. So what this table does is promotes a really nice extension pattern. By promoting this extension pattern, we can get movement from the neck all the way down to the low back, providing nourishment to those discs and those joints so that the patient is moving better. This also tends to help facilitate what I do as a chiropractor by allowing things to move a little bit more fluidly when we begin the chiropractic manipulation side of things. Another common treatment that we just started offering here, which is brand new, state of the art, is going to be compression therapy. Now, the further that we get away from the heart, the less circulation we have. So when we have swelling in our knees, our ankles, wrists, joints, and shoulders, that's when the inflammation will tend to sit and pool, which prolongs the healing process. What compression therapy does is squeezes and relaxes in that pattern. That pumps the inflammation back towards the torso, reducing swelling and inflammation. It also increases our blood flow, which promotes healing. So we've seen patients come in here with sprained ankles, and instead of it taking 3 weeks to heal, we can use the compression therapy, most of the time getting them back to play in a week, week and a half, coupled with some of the other things that we do.
So those sound like some very good and effective treatment options based on what you just said.
Absolutely, and what they really do is complement the chiropractic side of things. So as a chiropractor, what I'm really looking for are joint or vertebral restrictions. These restrictions can develop from a variety of things, whether it's your workstation ergonomics, your sleeping position, or maybe you've just generally had an injury. What I do as a chiropractor is I address these restrictions and induce motion into the area so that you're moving more fluidly. What happens is when you have a vertebral restriction, two main things are going to occur. First of all, the nerves that exit that vertebral segment will get irritated. That's when we'll begin to feel pain. The other issue that we commonly see is if you're not moving well in a specific segment, the vertebral segment above and below now need to move excessively to pick up some of the work, which will also then cause irritation. So it's really important that we address the spine as a whole, address these restrictions, induce motion so the patient is moving well. The last thing I want to illuminate is definitely going to be the custom therapeutic exercise component side of things. We tend to put a lot of emphasis on that because that's what's really going to maintain the results long lasting for the patient. So what we do is we find out exactly what the root cause is behind each patient's complaint and customize the routine to fit what's best for them.
So I wanted to ask you, Dr. Balkin, how do you diagnose and determine which of these different treatment modalities that you offer here at your practice really is for each different patient? Because as you know, no two people are truly alike, right?
Absolutely.
And that's where your integrative and customized approach really comes in handy.
Sure. So when each patient comes in, you know, we've already talked about some of the treatments, but when they initially come, the first thing that we're going to do is a comprehensive examination. Now what this includes is a detailed history, and it's important to illuminate that aspect of things because that's where we can identify any type of external factors that may have contributed to their injury in the first place. We look at their diet, their nutrition, hydration, how they sit at work, how they sleep, generally how they move. These are important things that give us good information on where is this issue coming from and why. Then we go into more of the physical examination side of things. This is going to include more of the movement assessment, range of motion testing, orthopedic testing, neurological, and reflex. Again, this all gives us different information as far as where's the issue coming from and how can we truly address it. Once we identify all of these type of issues, then we can really develop the care plan based on what is the patient's issue, what is their goals, and what are their capabilities. Here at Optimal Performance Rehab, we have a ton of treatments that we offer, and we do it uniquely based on the patient in front of us.
You really do spend that time, whatever amount is needed, to really get to know each of your patients, to find the root cause of their problem, and then really customize an effective treatment plan utilizing that integrative approach. Now, as far as how the treatments are performed, I know they're all done here at your practice, at your location here, but can you tell us a little bit more about that?
Yeah, so most of the treatments that I offer are going to be hands-on. It's going to be me performing them, things like the Graston, things like the cupping, the flexion distraction table, which we've talked about, are all hands-on treatments. Some of the passive modalities happening, some of the things that happen, without anybody, I guess, touching you are going to be the intersegmental traction machine and more of the compression therapy. Both of these therapies are more on the passive side of things. We tend to have a mix between manual, active therapy and passive therapy. Absolutely.
Certainly good to know.
Yeah.
Now, what type of results are your patients experiencing?
Well, most of the time we're seeing patients get complete resolution of symptoms. The truth is that these results are really going to be dependent on addressing a lot of the external factors, addressing the root cause, and really maintaining those results through addressing those issues, as well as coupled with the customized exercise routine that we build you to be able to have long-lasting results.
Now, are these results permanent? And I put in the disclaimer when I say that statement that I know, again, it depends on each patient.
Absolutely.
Their particular situation.
Absolutely.
And what is needed and required to keep maintaining those effective results after
Absolutely.
they've gone through the treatment plan. But can you tell us a little bit more about that?
Yeah, you said that beautifully. It really is dependent on addressing these external factors. Things like, how do you sit and move at work? How do you sleep? How is your diet? And are you keeping up with the customized exercise routine that we build you? If you are doing these things, yes, you will have long-lasting results. You will continue to see those, much into the future. If you tend to regress on some of those things, maybe the results won't last as long. Another thing that we definitely recommend to people is to come semi-regularly, whether it's once a month, once every other month, and maintain spinal movement, maintain the results by getting treatment semi-regularly.
Yes, indeed. Now, the number of sessions, I'm sure, depends on, again, on each particular patient and their situation. But typically speaking, what is the average number of sessions that you generally have them at least start with per week, for example?
Yeah, again, that's going to be dependent on the severity of the complaint, the length of the complaint, and what type of injury we're working with. We've seen patients finish in 1 or 2 sessions. We've seen patients have to take several weeks. It's really going to be dependent on, that type of injury and where exactly it's coming from. But generally, we have good results. Now, the way that I work here at Optimal Performance Rehab is I work on a week-to-week basis. So I won't give you some crazy long care plan because the healing process is really, everybody's body is going to be different and people heal at different rates. Usually the max amount of sessions I'll see you per week is 3. Generally, we do 2, and we do that on a week-to-week basis. If I see that you're getting better, we'll generally tend to scale down those visits. If you need more, maybe we'll bump it up to 3. But again, we work in a direct communicating back and forth. You're explaining to me how you're feeling. Each session that you come in, we pause and we make sure that we're understanding exactly where you're at in your healing process and how much more time we need.
We're now going to hear from a couple of patients of Dr. Balkin.
A couple years ago, I actually went on a run. It was a 5K race, actually. And after the race, I felt like a small pull in my lower back and in my glute and hamstring. It was a small discomfort, so I didn't make anything out of it. I kind of brushed it off for a few months. And then after, I would say, month number 6, this discomfort became actual pain. But being young and reckless, I was 25 at the time, I didn't want to go to a doctor. And time went by and this pain just intensified and I could actually feel it getting worse and worse day after day. And I went to the doctor, I got an x-ray, it didn't show anything, but the pain was still there. So a few months later, I got an MRI and that showed a herniated disc between my L4 and L5. The doctor recommended some physical therapy for a few months. I did that. It didn't really work. Then I tried some alternative therapies like ozone gas injections. I was pretty desperate. That worked for a couple of days of being pain-free, but the pain came back. It was nothing permanent. And lastly, surgery was recommended to me and I really wanted to avoid it. But around that time is when Dr. Balkin opened up his office here in Rockville and I came to see him, and that's basically what brought me to him. Dr. Balkin, since day one, he was very friendly. He listened to everything that I had to say, my whole story, how everything started, my physical history before the injury, after the injury, during the months of my pain. So once I saw him, he truly laid out a plan of action that he was going to do. And you know, since I've seen him, I feel 100% better, and I'm very thankful for that. So Dr. Balkin, I would recommend it to my friends, to my family, to any stranger in the street. He truly is one of a kind doctor that listens to you, and in my opinion, he did a miracle on me. It was like night and day from the times that I had extreme pain until now that I'm like back to working out, lifting weights with zero pain. I remember how I would wake up in the mornings and I couldn't even brush my teeth, because you know how you bend forward when you brush your teeth, that would trigger extreme pain. And now I'm lifting weights overhead, and everything due to the treatment that I got here with Dr. Balkin. He would never hold back with his treatments. As soon as I would get here, he would lay out the plan of action. He would try everything on his arsenal of treatments. We did cupping therapies, we did electrotherapy, we did manual work, we did a chiropractic table, we did compression therapy, CBD cream massage. And that is when I knew that I was in good hands, because he will never hold back. If he wants you fixed, he will fix you. So I would highly recommend anybody that is in pain to come see Dr. Balkin.
I constantly get shin splints. Previously, I was in the military for 13 years in the U.S. Army, and during my time, we used to run a lot in the military. So my arches in my foot end up falling. So what happened is I'd be running for a couple of days, and then all of a sudden I get these shin splints that prevent me from running for days. So typically the constant routine I would do is work out, and then later on, when I could not work out anymore due to the pain from the shin splints, I iced my legs and took days off of recovery. That kind of hindered my performance. Unfortunately, I was able to find out about Optimal Performance, and he came up with a preventive treatment plan for me. So instead of me waiting till I received the shin splints and couldn't work out for days at a time, I was able to continuously work out and prevent the shin splints from constantly occurring. Here at Optimal Performance, one of the main treatments they perform was the compression sleeves. They'll put on my legs for approximately 20 to 30 minutes. That'll apply pressure to my legs and relieve pressure, allowing blood to flow there. He applied direct treatment to my legs themselves to work out the knots in my shins. I feel the results from the treatments are excellent. Before, I would wait till I was in dire pain, and then the only relief I can get was going to a rehab center or trying to get treatment after the fact. Here, I feel like it's a more proactive approach where I'm getting treatment before the issue occurs and constantly able to continue to work out. I'm very excited here. They have a wonderful staff here. It's in a very convenient location, easy to get to throughout the day, and it's very effective treatment. I would recommend them because I think he thinks outside of the box. Dr. Balkin has a lot of different tools to use to specialize into your needs, and essentially do not have to wait till you get hurt to come see him. That's the great thing about it. So you can continuously be able to work out and be healthy before an accident occurs.
We're now back with Dr. Balkin. I must say, both Jose and Phil, very happy with the results. Some great work indeed, Dr. Balkin.
Thank you so much.
Now, we're literally out of time, Dr. Balkin, but I wanted to ask you, before I let you go, you and your practice, Optimal Performance Rehab, here in Rockville, Maryland, have certainly established a reputation for excellence, not just in physical therapy and rehab, but also in chiropractic care, utilizing your integrative approach, which you've elaborated on and told us all about the many benefits your patients are experiencing. But also in patient care, you all have a very strong reputation in really treating each patient like family, if I may use that word.
Absolutely.
And I just wanted to ask you what you feel really helps separate you and your practice apart from many of the others.
Well, first of all, you know, I am the owner, I'm the only doctor here. So when you come repetitively, you'll be treating with me. And when you treat with me, I'm not in and out of the room. I like to spend, you know, a solid amount of time in the room with each patient, both developing a relationship and figuring out who is the patient in front of me. Like you said, when you come into our office, we definitely treat you like family. So we understand that you do have a family and that you have a job. So when you come here, we want to make sure that we're spending enough adequate time with you to make sure that you're definitely getting your treatment and your money's worth for coming to our practice.
Absolutely, and I love the fact that when the patients come, as you just touched on,
Yeah.
they meet with you.
Yeah,
You're
absolutely.
the one who actually performs these different treatments, customizes the appropriate
Right.
integrative plans for each of your patients.
Right.
And that is a big benefit because,
Absolutely.
you know, they develop that trust and comfort with you.
Yeah, and you know, looking at things and doing things as unique per patient really is what sets us apart. You know, we have a lot of different treatments and styles that we offer here, and depending on who you are and what your goals are is what we can do to help you. So we definitely are able to help a wide variety of patients here.
Well, you're doing some great work indeed, Dr.
Thank you.
Balkin. You've got
Thank you.
folks coming throughout the region to you here in Rockville. And on that note, I'd like to thank you for joining us, educating us, and being a guest on our program.
Thanks.
It was a great pleasure having you on.
Thank you so much.
Thank
Appreciate
you.
it.
We'd love to have you back on in the future.
Anytime, let me know.
All right.